Good afternoon, everybody. Welcome to the 11th Wild Wisconsin Winter Web Conference. I'm Jamie Machik with the Wisconsin Valley Library Service, and assisting me today in the management track is Shauna Kosegi with the Southwest Wisconsin Library System. Thank you, Shauna. We're so glad to have you here. So we are closing our management track today with a presentation by Dr. Julie Todaro, who's going to talk about challenges and successes in the post-pandemic library. And she will definitely share a lot of great information and food for thought for us. So Julie, whenever you're ready, please begin.
Thank you, Jamie. Thank you, Shauna. Thank y'all very much for asking me to come to Wisconsin. I miss having to or getting to travel around because I love Wisconsin. I lived a long time in Ann Arbor, so I miss it. However, the content that we have today is very loaded with information, but it will be, as you well know, on the website later on, along with another document which kind of provides you with some examples of things and some images like, oh, we did what do librarians do all day long during the pandemic infographic, as well as some interesting dashboard content. So it's great. We have, I think, 100 and some odd signed up. So I'm grateful that you all felt the need to do this. And I still can't believe we are in 2023. I told Jamie a moment ago that I literally leave this and go downstairs to my retirement program. And I'm leaving the college, although still working. So I'm really honored that I got to do this. I don't know why that says 11111, but there you go, when it transferred over. So that shows you the importance that we put on things. The reason why we add additional information in a written is so that you don't have to take notes during this. So please feel free to, if you have questions related to this, please drop them in the chat, and then I'll get a copy of the chat transcript. The questions that you see, the 6 questions that you see on the screen in front of you are really distilled from a number of questions I've had in the past 2.5 years. And I used the word distill earlier, but that truly is the way that people turn around or look over their shoulder and look back. You know, a lot of people, and I think this was especially true after the 1918 pandemic and after the small one that we had with SARS and the bird flu, several other things that have happened. People are just like, it's over, I don't want to deal with it. And that, in fact, is a very different kind of pandemic for what we're stepping out of now. So we have to look at the uniqueness. So where were the last years, or were they, how are they unique? And there's a word left out of there. So I'm hopeful that this is not indicative of me transferring this over. So I apologize for that. How does the uniqueness of the last 2.5 years matter to managers? And that's a huge issue because they do matter to managers. Where have we been for the last 2.5 years in terms of what we've done? Do you have, and I do, 5 major focuses or foci in terms of moving forward? And then I have a little management summative do's and don'ts and a little leadership summative do's and don'ts. And then what are the top 12 things you should do overall? But those are hard to wrap your brain around because I'm in a smaller setting, many of us are. And so even in the larger settings, we have so much to do that the top 12 things are not going to be done quickly. So what I do is kind of pull that apart and then create what are the 10 things that you can do tomorrow. The first thing I want to talk about is what the difference was in terms of this pandemic. And if you can relate to any of this, you certainly, most of us had a very similar experience, no matter what state you were in. Although I'll be honest with you, the Midwest seems to have done a better job of communicating with their libraries throughout the pandemic and assisting them. Frankly, I couldn't have made it through the pandemic without Project Realm. And that was such good credentialed information. So this pandemic was unique in a couple of different ways. It was literally a roller coaster. And I think I'm not saying that other pandemics weren't, but because of our media and the information and the global media infrastructure that we have, things were far more up and down constantly. So while I do think that was the truth in the first or even the second pandemic, we knew about it now. So things were moving more slowly. There were many more stages in public health challenges. And when I started my book, the content for me just fit nicely into 3 stages. And then I think I got maybe to 21 and the middle of the spring of 21 and decided, you know what, I need to let people choose their own stages and actually need to add one in. We definitely had more variants, as we all know, and then more subvariants. And, you know, you can only read so much of that before you just want to stay home and put your head under the covers there, but definitely more variants. And I've moved the discussion among my staff from the COVID issues to seasons. And what I mean by that is people are far more comfortable with the reality that we have now, which is flu season or allergy season. And so, in fact, I read an article yesterday that said that not only is COVID going to be referred to as a season, they are talking about having an annual, starting out a vaccination, but then having an annual one, similar to the way you may get a flu shot or not. So you might get a COVID shot. So that's good. The ages and stages of infections and death were dramatically different, obviously from anything you and I have dealt with before, but definitely within the pandemic world. In the 1918 pandemic, children died first in great numbers, and then it kind of hit the elderly. And part of that was me being in that category now. Part of that was that we had far more intergenerational households. So children would die, and then their grandparents or those people caring for them or those people in the home with them would die as well. So this was a flipped pandemic. Actually, people in the workforce, older people got it first, the more vulnerable, the more visible, the more varied they were in where they went every day, and frankly, the more attitudes they had toward it. So not here to talk politics, but we do know that the politics of the situation greatly changed this pandemic and the recovery from the pandemic. So it flipped, and children came in at the end and even had one of their own variants. And RSV is not a variant of COVID, but it's definitely a season and related in how it's treated. Implementation of issues was longer, and I think that's because of the more global part of it. A lot of my library, for example, I have 11 libraries, and I have, just counting, 2 public service stations at least at each one, if you count reference and circulation. And so I was loath to combine those. So I had 2 people at one desk, but 2 stations, which meant I had 2 sets of PPE. And that implementation, if for no other reason than numbers, but certainly the whole supply chain, meant that I simply couldn't get what I needed when I needed it. Now, I was a little lucky in that I started thinking about it in February rather than March, January and February. In fact, I started buying and warehousing PPE in January of that year. And that served me well, believe me, when we got down to having to ramp up pretty quickly in people's safety and security, because I actually provided PPE for my workers at home. If they didn't have it, if they had a hard time getting it, I got them masks and sanitizing and wipes and things at home, primarily because we didn't know we were coming back in. And I'm sure if you're managers, you know that you cannot mix a lot of cleaning supplies. So I wanted the same kinds of supplies at home so that we weren't bringing in all sorts of things and mixing them and causing problems, respiratory problems in that. We had a far greater global to local economy issue. I was stunned at some of the supply chain issues that happened. Now, that, of course, was exacerbated if you just take a look at that the Mississippi had been to 6 lanes for boat travel or ship travel certainly conveyorship, and was down to 1, which meant that it was exacerbated by global warming, by issues related to no rain. It was amazing, but the global to local was a huge impact on this. Health standards were changing in the middle of this. And so one of the things I talk about is the uniqueness of having to pick a standard. And so you worked with your county, or you worked with your city, or you worked with your board and decided which credentialed organization you would go with. Would you cite CDC? Would you cite your county, which is where most of the medical information comes from in terms of the federal government? How were you going to do that? So that was a big deal. And then just the fact that information itself was obviously slower, in that there was such a great amount of it. And literally we would change course 2 and 3 times a week. But I was focused on a particular credential, which was CDC and our county. And so having to balance those was an issue. And along with that, of course, no single source. We did not have a single source of information, but I really pushed people to pick one. And we picked sort of 1.5, but we started with the federal, stayed with that, and then went a little bit to county. And I think going forward, you will see your stakeholders and your individual people in emergency management sorting out how they're going to do it. Who's going to run the dashboard? How will the data, how are they going to flow? So data are definitely flowing differently than they did before. And then, of course, we cannot minimize the controversies over the credentials and the credentials themselves. The data that we had for comparison data from 1918 was not only scarce, some of it was non-existent. I had in January accessed a PBS show called The Epidemic, I think, of 1918. It was horrifying to me, if you ever get a chance to see that. And the images, other than coffins piled up in the street corner, which they had, and they were all children, the images were striking. And what was so bizarre was that there were very few newspaper articles. There was very little content that I could then access or find in an archive or find in a repository that was helpful to me. But the images were extremely helpful when people wore masks. And at one point, I took a picture of Central Park and the tents they set up in Central Park, and compared that to tents from 1918. And honestly, they were almost identical. And then my niece, with my name, was head of the COVID unit in Baltimore at the hospital. So I got a great deal of background information from her, and the fact that they too were kind of shooting in the dark on a lot of things, as we all know. The treatments were very different from the first one because there were more of them and they came quickly. And the vaccine was accelerated probably by a year and a half over what the 1918 vaccine had felt was going to be helpful, and that was extremely important. I think competition among the free market of medicine and research was contributing to that. The federal money was huge with that, and then people had a variety of ways of looking at the vaccine and which one they wanted, or not at all, as we know. The whole concept of herd immunity, which was a big push in 1918, and Fauci brought it up, but people definitely didn't count on it, simply did not show up in the same way that it did here. And it certainly didn't by the summer of 21, which they thought was going to happen. I think we're just now in the spring of 22, we just now saw some of that happen comfortably. And the fact that the standards from CDC talk about if you're vaccinated, how can you stay the most safe and what you need to do that. 2 things. One is vaccine and the second is mask. And so mask crowds, mask outside, not your bubble, those days are gone, but mask if you have an unknown crowd who's very close to you. So I'm telling you things you already know. There remains to be 2 things which exacerbate public health. One is events that are entertainment, like singing events, which unfortunately for many people church comes into, but singing or entertainment events and then travel. So those are things happen. In a minute, I'll talk about how I worked with my staff on that. So what are we looking at in terms of a recovery? So how does our uniqueness matter during recovery? We had very few precedents to go by. Longer road to new normal. Some of these are pretty obvious to you. I will tell you, I'm going to get back to the third bullet of the human recovery in a minute. I'm reminded every day of the problems in that area, and we'll talk about that at the end of this list. People are never thrilled with uncertainty. So the vaguer you are, the more uncomfortable people are. It will happen in the fall is not a good statement for your staff. This will happen by the holiday. It should happen sometime next year, which may have been statements from credentialed people, which were absolutely part of the landscape, but it contributes to the unease of staff. So using different language, different specificity, and certainly uncertainty among different stakeholders and groups was always deadly. We had more extremes. In fact, you're not really used to hearing about people in the profession dying from an illness. It's certainly not in the numbers. And we had some things in Texas happen, some libraries in South Texas that stayed open. A woman died who was an AD, and young woman, 30s, from COVID. And so people were wary, as they should have been. I can't speak to her health. I can't speak to her vulnerability. It was just the presence within the field of that. And that was a big deal. So the extremes were in the conditions, and then the speed with which it was transmitted. Went to a church service, dead the next morning. Those kinds of things. I don't say with levity, I don't say them easily, but they in fact were true. And then, of course, with media, we had far more extremes. And so I had to deal with that with staff. And I'll mention that when I get back to that in a minute. The timing that we had, the speed of the changes themselves, once we found out which road to take, at some point in time, I know that on our Back to Campus committee, which was every Wednesday, we started out thinking we could talk every Wednesday. And then, of course, we found out we needed to talk Monday and Thursday. And there were some weeks when things were different within those timeframes. We know that we always have competition, for programming and books and space and wireless, et cetera. And we really stepped to the fore in terms of competition, because most libraries were back in there with services, even if they were remote. I went home in 48 hours and told everybody I knew, because I was so proud of the staff, frankly. 24/7 reference, we'd always had that. And it was a tribute to my staff, really. But we did have a lot of competition going into the pandemic, and those were kind of whittled away. And so we made a lot of headway by pointing that out to people, quite frankly. Safety and security is very different from the way it was before. Buffets, food buffets, sharing computers, workstations that are touchdowns in new spaces. The whole world of architecture went to design shared workspaces and touchdown, hot desks, all of those things. And then it was like, no, I don't think so. Without a significant trained cleaning process with significant cleaning, and still people didn't feel comfortable for sitting elbow to elbow. One of my libraries, I had computers next to each other, and allowing for wheelchairs, there was 8 inches of space between their elbows. And we immediately tried every other computer, and more than likely, quite frankly, we'll leave it that way for some time. Communication always needed to be contextual. We needed to provide references. I'm saying this because I am using these data, and that was critical for citations. I can't say the color that we're looking at is orange or red without a dashboard data dump behind that. And so it's extremely important for people to, I think, continue those kinds of references and citations, because even, you don't want to open up the argument to, well, who says that? Well, as you know, we've picked one particular person to stay with, and this is what we're tracking on, and these are their credentials. So we all know, no surprise here, an incredible reliance on digital and multiple information channels, of course. Business continuity was unclear for all of us. What could we keep up? What could we not? The big focus that I saw most states focusing on was EDI, and also on issues about technology and social distancing. And I will tell you, I told you earlier, I'm a little disappointed in the way that the infrastructures who support us did. I was very impressed by what Wisconsin did, and frankly, Ohio and some other states for how they set up communication that was supportive of digital and these multiple information channels, which they really helped to narrow down for people, and also credentialing services that people did and putting things in place to make those services possible. Assessment, totally different for us now in terms of what we count, how we count. So we have a chart that we have that says these are the data we keep. This is who needs it. This is how often it happens. And this is the mechanism we pull it from. We have to totally redo that. And we still keep up with some things that are due, federal data, grant data, but we've also made some major changes to how we count what we do. And then we found ourselves, if you're a manager, you found yourself being both reactive and proactive. And I wouldn't say libraries are used to that for the most part. That was a very different kind of setting for us. In the past 2.5 years, I've isolated these 7 things. And the reason why I do that is because when I report out, I divide my content to stakeholders and managers in these categories. And so you can take a look at this later on, but basically I look at who does what on the staff, what our hours of service are and what those closures are and what that closure means. So if someone would say to me, I hear the library's closed, I would say, no, it's not. We still have reference, we still have books, we have a curbside, we have all those things for use. So we're there, we're just offering it differently. In fact, I branded this with I told my PR people to come up with it, and they did kind of a invisible person poster, which was phenomenal, that said, you can't see us, but we're still here. And then we had glasses, no body, but glasses, and the headset sitting in the library, but there was no body there, just looked like the invisible man. And so very quickly, they learned that the word closure was not what my definition was. We were open. We may have had reduced services, but we were open with a different approach. Remote, totally different approach to that now, as you know. We are defining and redefining our services. We have a new normal, and I used to hate that. I used to hate the phrase paradigm shift, and I embrace those all now. We have relationships with our users that came right back on board. Some of them never left, but I have to tell you, those users and their expectations have changed, and they had the same issues, obviously, that we do. The long look at space is a huge one for us. In terms of just older, I have a mix of older environments, really old, historic kinds of things, and newer. So now we're taking the long look at physicality and proximity, user interaction, staff interactions with each other, staff workspace, hybrid schedules, the infrastructure to facilities. The HVAC was blown out and cleaned in all 11 of our locations. And I got some they look like, interestingly, they look like little units that you would put on a broom, and you put them over the exchange, the HVAC exchange, with a little bit of sanitizing approach to sharing HVAC within an infrastructure. And then, of course, furniture, how old your furniture was, the placement of it. You know, furniture for me is old, and so I couldn't clean it. It was not possible to be cleaned because of the age of lots of it. So we have lots of issues to do with that, but they fall into these categories. So when I reported out, everything fit into there. Training was under roles and responsibilities, redoing management documents is under each area. So it was important that we really take a look at these categories. And then what are the 5 focuses that we have moving forward? I bold-faced here what the 5 major things are. And that is the integrating or institutionalizing remote, what that means in terms of roles and responsibilities, which is a far broader definition than you or I had before. The communication that we started then. So if I had to distill that down to one thing, it was consistent. You have to have consistent communication. So it was a time of day, a type of communication, a template to get that out for you. So people really worked with that, and it really assisted people in making those changes because they could count on the template and the timing, and that was critical. You must deal with change in and of itself. So what we're talking about there is that the whole concept of change is not foreign to anyone, but it's not one people are thrilled about. And I used to do a workshop for Llama, and I would go around the country doing this, and I would talk about change, and I'd say, characterize change for me. And the vast majority of what they talked about was a negative. Very few people said, oh, I love change, it's great. You know, we don't have a stock market profession here that's up and down every 20 seconds here. We have people who are professionals, who are used to standards, growing infrastructure, you know, scaffolding information. It's just not something that it's easy to work with. So dealing with change in and of itself, how do you change? What's best for change? How is it reflected? And if it's not in your job descriptions going forward, and that is able to deal with change or something simple like that, you need to put it in your job descriptions. Flexible workspaces are critical, and that may mean moving things around, you know, getting power poles if you don't have floor plugs because floor coring is so expensive. So that's critical. And we really don't have a set of guidelines and standards that either you or I could point to that were COVID. We went from 8 feet in some cases, which was too much, to 6 feet, and then 4, and then 3. We've stuck with 3 for most of our physical areas that we have for interactions and proximities, but most people don't have those hard and fast. It must be this big, it must be this kind of interaction, you must be this distance away. And I'm hopeful that some of those things come out in public health content. We also, greater than any other time, have health concerns. And this is something that I've always paid attention to, but never alerted my staff to. I would alert them to things like flu season when I felt like we needed to stop sharing our phone, because phone would be on reference, and you'd have someone long before cell phones come by and say, can I use your phone? And we'd say, sure. And I was like, you know what? There's phone in the hall. We got special cleaning for phones. We clean keyboards in an unusual way. We alert people when by signs on the door, and we did this during the pandemic when we opened back up again in terms of sanitizing. We put sanitizing on the table. And then the whole concept of employee health and wellness. So I said I was going to get back to this. At no other time have I been as interested or legally careful to find out or to recommend a guidance for well-being outside the workplace. So, you know, you tell people to stay safe, you tell people to be careful in the rain. We have closures in some places with heavy weather, but we really don't deal with health and wellness. And health is how someone is, it's their being, and wellness is living and how people live their lives. So it's, I would say 50% of we've seen a 50% increase in employees concerned about health and wellness, unable to return to the workplace in the same way. We gave them the option to vote for masks, et cetera, and that's been an ongoing thing for us. And so we are, I created a document early on, and I said, these are the things I'm doing to keep you safe. We have these for you to take home. We have this, we have that. We have all these things available for you to take home. And so I'm not requiring anything. I can't require it once you leave. What I have is the opportunity for you to use these things. So here are my recommendations for home. Use your health, put together bubbles in your friend areas, attend the store, go shopping at this time, wear a mask. So what I did was not require that, but I said, these are the 6 things that I'm doing to assist you and your wellness in the workplace. And here are the things that I'm seeing assist you in your remote wellness issues and health issues. And I was very careful about how I did it. I can't require it. I can't tell people don't do this or don't do that, but people share with me that they felt comfortable with it. They were pleased that we gave them PPE, but they like the guidelines because we have people in shared living situations. We have people who didn't have wireless, and so they needed to go to local stores for it. We had checked out as much technology as we had, but we did not have remote wireless except the cell phone core access, and that was very expensive. So we would identify places around town where there were wireless hubs for people. So the broader health concerns I've clearly backed off on. They know what they need to do to get better, but it was a very helpful exercise, both for me and for employees, to tell them what we felt were the not only the things that we were providing at work, but also providing for them so they could take it home, and then recommendations for home life and for other jobs they may be going to, or for an education setting that they might have, or for their children, and how if they have children or partners, what might mean for bringing people in from those locations. Cleaning tips, all of those things. I think that it's a departure for us to look outside the workplace, but it was very helpful to say, here are the things we've done. You might consider doing these things. And we will continue some of that going forward in that we set up a process for employee groups to talk about, okay, do you want this PPE? Do you want that PPE? We think that we should have hybrid scheduling. How will this work for you? How will that work for you, et cetera? I have 5 successful things for management. What I think is it will help you with success, and things that you shouldn't do, or that I think you should reduce. The first is to take a quick look at your operations content. I set my strategic plan completely aside. Don't even look at it. I didn't look at it for 2 years, and really worked on operations. We looked at position descriptions during the pandemic, and we looked at new terminology, definitions, and did that affect our policies, procedures, and signage, as well as our customer service scripts. So we revised our scripts and how we refer to things for not only ourselves and our employees, but also for our clients, our patrons, our users. I totally suggest that you assess your data gathering and that aggregation. And then what you're looking for is value, impact, worth, benefit of new things that you're doing. And I use those 4 things because they're different things. And you want to look for content that gives you those definitions and provides you those differences. Who needs what? Then you need to prepare documents, and I'll refer to this several times, a PowerPoint that's ready to go, an executive summary that's ready to go, a dashboard to point to. This shows decision makers, your boards, your advisory, your governing, stakeholders, your funders, if you have votes coming up, that shows where you are in those categories, what you've done, what you need, how you need to recover, and what you need to do it. It was very important to take a look at the data that we did gather during the pandemic, primarily as a baseline, to see not pre-pandemic numbers. That's not your baselines. Very important, but we have that data. But what we really are looking at are the data for the baselines after, let's say, 18 months to 2 years of the pandemic. What shifted? What changed? And then how does that go forward in the future? The other thing you have to do for success is integrate consistency and technical writing and technical style into all your communications. Narrative does not work. More than 3 topics in an email, the old keep it simple, stupid. You need headings, you need standardized terminology. Years ago, I created standardized subject headings for all of our emails so that people could sort their emails. Still need to do that. Librarians are classic for subject headings. Clearly, the idea is not original with me, but it became our business continuity operations communications. And then you need to create content to post, present, identifying changes, impact, and why. So we are no longer doing this. Instead, we're doing this, which is even better. Or we had this service, we still have it, but it presents itself in this way. So you need to present those changes that were going to be temporary or permanent and why those concepts were there. I don't want people, and I have 4 don'ts here. And one is don't forget to establish your post-pandemic timeline for changes. Don't forget to include impact of the pandemic going forward in your budget requests so that people can see, well, you didn't spend your supply money. I know there were fewer people coming in, and how those dollars might have to be moved around. Are they going to return to normal or some new normal going forward, et cetera? And that all has to go into your budget requests for next year. And like me, you probably used them last year's budget requests as well. Don't ignore the data from the past 2.5 years, even though you have significantly different data that you had, or those data are very different. So I mentioned earlier that you use it as to show differences, changes. I've never worried about my data going down and fewer uses. I've really looked at those uses in terms of impact. Are my users newer? Are they older? Did I get more school kids because the school libraries are staffed differently now? So you really need to justify those data more than you did before, or as you're doing, and then really determine what impact the pandemic had on those. You need to take a look at your training and onboarding in terms of what's new. So we discussed having, oddly, an onboarding of staff when they returned and when we opened up again, because we were very different. We had to talk about user expectations. We had to talk about the terminology I mentioned. We also had to talk about their roles and responsibilities changing, different signage. People had been used to certain things for years, and we were going to be changing some things. So we really almost have a different onboarding than we did before. So we have some leadership do's or don'ts, and these are big picture, but they're critical for people to take a look at what differs from management. And I feel very strongly people need to divide those up. So for success, you need to take a really close look at your organizational culture now. And how is it different from the way it was before? What happened during the pandemic? I always recommend that people do a real quick survey of staff that has 3 questions. What changed during the pandemic that you don't want to do anymore? What changed that you think should be integrated into what you do? And I also asked, but that's unique to my organization, how do you think your infrastructure and your umbrella groups handled pandemic? Because we need to, in many institutions, frankly, rebuild the trust that we had with staff who said, don't they care about us, et cetera. And early on, I identified the fact that so many places around us turned back to their hourly staff without benefits and lowest paid to offer some of the frontline help. And it was almost criminal. These were people without benefits who were put back out in the front lines, while a lot of people were not on the front lines who could have, and I don't presuppose people can afford, but benefits and non-benefits was a big issue for us. So it was even more important to talk about the trust that people had for us to rebuild what it was that we feel that when we care about our employees and how we communicate that to them. So I also think leaders need to communicate our commitment to equity, returning to the standard of equitable scheduling, roles and responsibilities, expectations that we have of employees. And as I said in the earlier bullet, just organizational concern and how we are thinking about their health and well-being and how important that is to us. We do need to address change in and of itself, and to say this is a change for us. Here are 3 ways to get used to that change, and here's why I have to change. You know, I have all complete control over this. I have moderate, you know, minimal control over this. I have no control over this. So let's focus on what we can do, and if we need to change things. And that's a critical part of the trust factor when you address change. And that is telling people, look, I stuck with this. Let's take a look at how it's best going to work for us. And then I think people need to revisit their vision, mission, and values, and take a really close look at, is the language in these documents and in our feelings and commitment, is it the same? Do we need to change that? And I'll tell you something which I feel is which I know is a little controversial. And that is that libraries are the first to say we are safe spaces. And we're not. We are intellectually safe, perhaps. We certainly show little, if no judgment, if at all possible. But the word safe is a loaded word now. You have to be very careful about saying libraries are safe spaces, because I cannot guarantee safety. Frontline safety now is a totally different definition than it was before. So let's be very careful about how we use our intellectual safety, our equitable, our EDI safety, our thought group thinkers safety, but not the concept of safety the way people have been looking at this for the past really 3 years, obviously before that, but certainly recently as well. So don't stop your communication that's consistent. You can reduce it, but re-identify when that's going to come out. Don't forget to lead by example. If you say one thing, obviously, if you're supposed to wear a mask, wear the mask when other people see you, or identify why you're not. And that's a tiny example here for something as important as leading by example. Don't ignore the expediency needed for timing and communication. And that's one of those things of, I can control this communication and I'm going to get to this within a day. And so you don't want to return to any delays in communication as long as you can. And if you do return to a longer timeline for decisions and feedback, let them know why. That's extremely important. And then don't ignore opportunities that you may see in people who are expanding or did expand their leadership roles and responsibilities during the pandemic. And what roles were they in? What roles might they take on? And although you might say, well, you know, I really can't, I can't give them raises, I can't move them into other jobs. What can you do? Can you create different aspects of their teamwork? Can you have them lead or co-lead teams? Can you change language in their job description? Can you make sure their resume points to the kinds of leadership things that they've done for the past few years? That's extremely important. I have 12 management areas that are very important, and I bold-faced those things that I will specifically mention. And then, as I told you, I have a little bit more drill down that you will see when you get this posted to your website. One is, and these are repetitive somewhat, but employ and continue the remote communication techniques, which you started. And then earlier I said, and make sure they're consistent. Practice honesty and provide evidence to things. So I know I don't know, I can, I can't, and I can control, I have no control. And a lot of leaders find that difficult to identify for people. No, I can't do that, or I can't control that. So we have to start saying it when it's not a complaint. And surely during the pandemic, there were many times I said, I can't control this decision, but let's talk about the impact of that on our services or our clients or our people. And so it was very important that people look at those words and how they use them, because people want honesty in their leaders, and sometimes we need to rebuild that after a particularly low motivational time. Take a look at identifying your audiences and the groups within your employees, and make sure that you match the communication that you create to the audience, to the processes that you're talking about, to the products that you're talking about. One word was not the same word to send out to everybody. You know, we had stuff for staff, we had stuff for public. As I mentioned before, we changed customer service scripts so that they would be accurate but honest. Take a very close look at your marketing and see whether or not you want to do any post-pandemic revision of that marketing, using new terminology, focusing on the kinds of success that you had. After Katrina, we had a lot of interesting public library branding changes after they were identified as first responders in not in federal funding so much, but certainly in getting parts of federal funding that came through cities and counties. And so how or can you integrate that into your marketing? Do you need to make sure that people know what your roles were and how successful they were and the impact they had and how important that was and how wonderful staff were? And several of you mentioned that in your chats. You would say things like, oh, I was so proud of what we did. And people would say, you're doing so much already. And now you added COVID testing handouts. And those are the kinds of things that people need to take a look at to make sure that people know you're stretched thin, but you're still maintaining the kinds of service that libraries that are so important to people in terms of their community and their libraries. You want to adopt or require technical writing, and I'm going full speed on that. Narrative language does not work in the management sector, and it does not work for communicating COVID information. I really push people to use data visuals with paradigm shifts, infographics, different kinds of design, categorizing things differently. Infographics, I mentioned to you all that we've done one that said, what do librarians do all day long? And it was fascinating to see people take a look at the Wordle that was done, but then the actual images of people. They were really interested, and the administration was actually interested to see that, because I got an email one day saying, what do your hourly people do during the pandemic? Because I kept hourly people on as well. And I had a list. I said, here are the 23 things that we've got going on, and here's who's doing what and for how much period of time. And I got a note back that said, okay, that's it. But that's not easy to do. Your staff really have to take a really close look at what's happening, how roles may change, and make sure that they've captured that in content. Data visuals are one really good way to do that. Tufte, T-U-F-T-E, is of course my champion with visuals. So if you haven't seen visual quantification of data, is extraordinary book, and he's done some other things as well recently that are quite good. So I want you to integrate alternative aggregation of data in terms of how you deliver. And that's a clear, I mentioned before the importance of aggregation of data, one whole chapter on data. And then, you know, I don't do this for making money. Please believe me, you don't make money through selling books, but your state library has copies. There are some e-copies you can borrow that I think will give you visuals with paradigm shifts in every single chapter. So you can certainly take a look at some possibilities for you that you can plug your information into. Choose a focus. Choose not all four, but one: benefit, value, worth, or impact, or maybe two, because they are different. And then the other thing you have to do is address the intangible in some way. People always say, oh, you know, we really can't talk about what we do in the reference desk. It's kind of intangible. No, it's not. It's very tangible. And you need to take a look at that kind of tangible versus the intangible. So it's very clear what you do and how well you do it and the numbers you do. And then understanding, making people understand more is not necessarily better. It's the success of the interaction, which used to be kind of intangible and not aggregated, but now we need to. Something you're already doing, I'm sure, which is to assess your service and resource delivery, new measures, communicating expectations. What do we want you to do and when, what works? And then I mentioned standardized terminology in one of the other lists, and then focusing not just on items, but access to those items is critical. So I can't go over these, but I wanted to give you a very narrow look at the top 10 things to do tomorrow. And I mentioned to you the importance of doing a survey. I have the 3 questions that are great for survey, and I've isolated and kind of pulled things apart. So you're not going to be able to start assessing all your measurements tomorrow, but identify which process you want to use for that. You want to call in copies of all the record keeping things that you have. Begin the discussion with your decision makers on what terms do need to stay and what can go away from the pandemic. Begin the discussion, excuse me. You like that song? Sorry. Begin the discussion with decision makers on what pandemic terms that you need to keep going. Begin the discussion among all your staff on what remote activities can be retained. I mentioned to you earlier, you need to prepare a presentation for your umbrella organizations. And I have recommended that people put that on their website and say, what did we do during the pandemic? Look at what happened to the library during the pandemic. And then they get the opportunity to see some of those things because people aren't going to be in those presentations. And you've obviously done them for a visual or a Zoom or a Google Hangout or whatever it is, Adobe X that you're using. So I would leave those on the website. And the way we've done our dashboard is it's linked from our homepage. And then we have a books and resources section. We have a staff section. It's an important way to look at things. Distribute a communication for a new timeline. And that's true. You want to start, if you haven't started already, just defining your timeline and making sure that people understand you may be in stage 4 and that you're keeping some things, leaving others out. Distribute a communication, and that's my 360-degree employee concern for health. And that was the health versus the well-being. I had originally recommended the World Health Organization. They have not reduced their content, still very valuable. And if you live in a port or you live at a border situation, you have a lot of international students or coming in from high schools nearby or elementary schools, or you have a lot of immigrants in your area, definitely look at the WHO content because it's quite good. And then obviously CDC, and then changing that to your 360, what you can do for people. And obviously you're doing that within HIPAA. Announce that you are going to review the library's mission, vision, values. So again, I'm not going to tell you to start on it tomorrow, but let people know that's one of your steps that you want to do by the fall. Query your peers, and I know Wisconsin already did a great deal of that during it in terms of if you have a benchmark institution, what are the 3 best practices people had? What did you do that you wish you hadn't done? And what was the most valuable piece of information, most valuable advice you ever got? And then set aside any strategic plan you may have until the end of this spring, and then revisit it, compare it to the old one, see what's not possible, see what you want to bring back. But it is definitely at the crossroads for our strategic plans. The number of years, we've all lost years. If you had a 5-year one or a 3-year one, we've lost those. So you can very quickly identify what kept going and what worked, but what you need to change in order to create a reasonable strategic plan for going forward. I would like to thank you for attending. I know you had a lot of, you had other sessions and it's the end of the day for you. So I want to repeat that we have 15 chats now, and I want you to add some things if you'd like. Thank you for your thank yous. I appreciate those. You've asked some questions here, and do we as librarians do something differently post-pandemic as people are living and working differently? Yes, you do. You market to them differently. You have different possibilities for feedback. So I'm going to take this chat. I've already asked Jamie to capture this, and I'm going to be aggregating recent content. You should have different programs, and you should look at purchasing materials differently. And again, we're not changing everything we do, but there are some really valuable lessons to learn from that. So I absolutely want to hear from you. I hope I know some of you from other places in Wisconsin. I'm glad you think this is thought-provoking. And I am so pleased and so honored that I got to do this. Y'all have a great conference, and you have had one for years. So they'll post this to the website. You'll be able to get this information, and then she'll also post the replies. Thank you, Jamie.
Thank you. Julie, I have one question for you before we.
Yes.
Today. So we had a session before this one for geared toward brand new library directors. And there were a number of people in that session who have been new directors for a couple weeks or months. So if you were starting, knowing what you know now and knowing that your retirement party is after this session, what is the biggest piece of advice, pandemic related or not related, that you would give to a new library director?
Okay, I actually have something here. I know there's no surprise. People say I have an opinion on everything. Someone asked me yesterday what the single most important piece of advice I give new managers is. And oddly, I had a huge number of new managers contact me after they'd taken a look at the book saying, help, you know, my organization is looking to me and I don't have anything. So my advice to new managers is learn how to document. That is the single most important thing that they can learn to do, is document, create a chronicle of what happens and how things occurred in the human resources area, in the patron complaint area, in the expenditure I've run out of money area. The whole concept of documenting and learning how to document is the single most valuable thing I would tell a manager that he or she needed to do. Learn how to do it. Keep your personal work diary. Encourage other people to keep a work diary so that it's not gone when a week or two goes by. You have a lot on your plate, and create that kind of road for looking back as well as looking forward. And trust me, throughout your first year, you will have multiple opportunities to create that. And I have a phrase that I use that literally people hate, but I use it all the time. And that is, someone will say to me, you know, what do you know about that? And I'll say, I have some documentation on that, and I welcome the opportunity to talk about it publicly. And people are like, huh, you know, and that kind of documentation moves you as a manager from opinion to documentation. And clearly it's a perception, but you have data, you have dates. You know, I can always say, well, I was wearing black. Well, I'm always wearing black. But anyway, black and big earrings, you know, that's the way it was. But those are two very important things.
Thank you so
much. And welcome to the profession. Welcome to management. It's great.
Thank you so much for a great session, and thank you for all of you for being here. So tomorrow,
thank you.
At 9 a.m. with tracks in marketing and sustainability. We hope to see you at that time. If not, we hope you have a great rest of your day. And so
thank you all.